At the time of Ebola Sudan virus disease outbreak in Uganda, Ministry of Health did not have vaccines for this particular strain. However, the ministry will soon receive Oxford and Sabin vaccines that will be used in the affected districts.
We are expecting about 171 doses of the Oxford vaccine and about 300 doses of the Sabin vaccine. As you see, these are small quantities. More quantities will come in November, and in November we are looking at 40,000 doses, 70,000 doses. Those are much more. That is why I'm emphasizing that for now we have to focus on community strength.
While opening the emergency ministerial meeting on preparedness and response to Ebola virus disease outbreak, Prime Minister Robina Nabanja emphasizes prevention in the fight against Ebola virus disease.
We are utilizing all parts of government to strengthen this response by deploying a whole of government approach to build on the capacity that we have across ministries, departments, and agencies.
Neighboring countries are now on high alert after Ebola virus disease outbreak in Uganda.
We are working closely with the surrounding countries to improve surveillance at the ports of entry. We are working very closely with the government of Uganda to ensure that the areas where someone has been identified as having Ebola are well secured with information. Because when the public has good information, then they will behave.
About 99% of vaccines are imported in Africa, thus a call to build capacity to manufacture vaccines by African countries.
By 2040, Africa should manufacture 60% of the vaccines that we use here on the continent. So it is a very big target, but we know we can be able to reach it.
The minister says more research is done to ascertain how long the vaccines are able to protect one from contracting the virus. Ebola is often fatal, but vaccines and treatments are now available for hemorrhagic fever, which is transmitted to humans by infected animals. The first cases were reported in Mubende districts before the epidemic spread to neighboring districts of Kasanda, Chegegwa and Kagadi. Human transmission is through bodily fluids, and the main symptoms are fever, vomiting, bleeding and diarrhea. Infected individuals do not become contagious until after symptoms, with an incubation period of 2 to 21 days. 5 affected districts have seen 54 cumulative confirmed cases with 19 deaths and 20 recoveries. Marian Womcha, UBC News.